Hey, welcome in to the doctor's office. Are you a new patient? Okay, so it's your first time seeing this doctor. Okay, and have you seen any other doctors in our office before? No? Okay. Alright, well, could you please provide me with your ID and health insurance? Okay, yeah, you can just set it right up here on the counter, okay? Alright, thank you. And I'm just gonna have you fill out your information on this piece of paper, okay? And it'll just ask you a couple questions about your medical history and just some other personal information, okay? Alright, perfect. So you can take this and then just bring it back to me when you're done, okay? Alright. Okay, you're done. Alright, perfect. Alright, and could you just tell me why you're in today to see the doctor? Okay, a sore throat. Okay. And what are the most common symptoms that you're feeling with your throat? Okay, and do you have any other symptoms besides a sore throat? Okay. And have you been around a lot of people? Maybe someone who also had a cold or something else going on? Okay. Alright, and have you been taking any medicine for your sore throat? Okay, just some cough drops. Yeah, that's good. Okay, yeah. And so you just haven't seen any improvement? Okay. Okay, yeah, so always a good idea to come in to see the doctor after your symptoms have been continuing for more than a couple days or a week or so. Alright, so let's see. Are you allergic to any medication that you know of? No? Okay, perfect. Alright, and can I get your height and weight, please? Okay, and over the past month, have you had any sudden weight loss or weight gain? Okay, excellent. Alright. And do you typically maintain a healthy, balanced diet? Mm-hmm. Okay. And would you say that you exercise weekly, bi-weekly, 3 to 5 times a week? Okay. Alright, and what kind of exercise do you normally do? Okay. Excellent. Alright, and looking at the paper you filled out, it looks like you have no major medical history, right? Okay. Maybe some slight anxiety. Okay. Alright. So you are in for a treat because our doctor here is one of the best. And so she's going to take excellent care of you. And she's very thorough in her exams, and she'll definitely be able to help you get the best treatment for you so that you can recover really quickly. So let's see here. Okay. So I'm just going to take your temperature really quick before going in to see the doctor, okay? Okay, so if you'll just open your mouth, I'm going to stick this under your tongue, okay? Okay. Yep, just hold it right there for me. Perfect. So our doctor is going to just be doing a thorough exam and just asking you a couple questions about your throat and anything else that you're dealing with. And she'll also probably prescribe you some medication, okay? Yeah. And so once you're done with your exam and talking to the doctor, you're just going to come back to the front here with me, and I'll check you out and make sure we have all of your prescription information and that you're good to go, okay? Yeah. Do you have any questions? Yeah, it shouldn't take too long, maybe about 10 to 15 minutes for the exam. Plus some questions and anything else the doctor wants to go over, okay? Alright, so I'm just gonna have you go to the door over here, and once you go through it, you're gonna take a right, and it will be the first door and room on your left, okay? Alright, and then when you come out, you'll see the exit sign above the door that you're going into right now. So just come back out through there, okay? Alright, so I'll see you in a little bit, okay?
Hello, it's so nice to meet you. I'm the doctor who will be giving you an exam today. So I see from my notes you have a sore throat. Okay. Yes, I see that my receptionist Lani did mention that. Okay, and so let's see, how long have you had it now? Okay. But otherwise you're feeling good? Okay. Okay, and I see, okay, everything else looks good, and you're a new patient here. Okay. Alright, so I'm just going to give you a brief examination, check a few things, then obviously look at your throat, and try to determine what might be causing that pain. So if you don't mind, I'm just going to start off by listening to your heart and lungs. So you can just stay seated right there. And I'm just going to ask you to breathe in and out when I say, okay? Alright. Alright, so let's start here. Deep breath in for me. Very good. Another deep breath. Okay, now on this side. Deep breath in for me. And one more deep breath. Okay, very good. So I didn't hear anything troubling, which is always a good sign. And now I would just like to check your temperature and your blood pressure, if that's okay. Perfect. Okay, just get my thermometer here. just place this under your tongue for a moment. Very good. Just give it 1 second. Perfect. Alright, so it's actually 99. So not quite a low-grade fever, but also not quite normal. So I'm going to make note of that. Now let's do your blood pressure. So take that out. And please remove your jacket. Yes. Okay, and then just slip your arm in here for me. Very good. Okay. Just hold that right there. Very good. So no concerns with your blood pressure, which is also great. So now I would like to just check a few other small things before looking at your throat, just to make sure they're working properly. So just very quickly, your eyes. Can you read the smallest line for me right there? Very good. And just cover your left eye and read it again. Okay, and now your right eye. Very good. And let me just use my flashlight real quick. So just look straight ahead. Very good. And just look straight at me. Okay. Very good. Your pupils are reacting normally, so no concerns with your eyes. Now I'm going to move on to your throat. So what I would like to do before looking in your throat is just feel your lymph nodes, your neck, around your face, just to feel for any tenderness and to see if it's swollen. So I'm going to put on my gloves. So just sit still and relax for me. I'm just going to gently feel your neck. And does this hurt at all? A little bit? Yeah, I can feel you are a little bit tender. Just going to feel the back of your neck as well. And then let me just feel the sides of your face. And does this hurt? Okay. But mainly in your neck area? Yeah. Okay. Alright, so let's take a look. If you don't mind, to ask you to just open your mouth wide. I'm going to just stick this on your tongue and take a look. So please just open wide for me. Very good. And I'm going to look at your throat. So I do see it is red. Not too concerning though. It doesn't quite look like strep throat, although I would like to test you for it. And let me just see the sides of your mouth. Okay. So can you describe for me exactly what it feels like when you swallow? Okay. So kind of like that scratchy feeling, but it's not so painful that you can't swallow at all, right? Okay. Alright, well, like I said, I would like to just swab you for strep throat, just to be certain. Now, I won't know right away. I will know later this afternoon whether it comes back positive or not. So, I can give you a follow-up call about that. But is that okay if I do that? Okay. I know this is kind of an annoying test, but unfortunately, I will need to swab deep in your throat to make sure I get a proper sample. But I will do it very quickly, okay? So let me just get my swab here already. And when I say so, I'm going to have you open very, very wide again. And I'm just going to swab this very quickly, okay? Okay. So please open wide for me. Okay, very good, very good. Okay, perfect. All done. So I'm going to just put this in my container here, and like I said, this will get sent out, and you will know later this afternoon whether it's a positive or negative. And I have a feeling that it is not going to be positive, which is good news. But like I said, I just like to check. So based on what I've seen with the exam today, I do think you just have a cold developing. But that being said, I will let you know about your results. If they were to be positive, then I would have you take a prescription, okay? But in the meantime, I'm going to have you take ibuprofen. If you were to develop headaches or even just to get that slight fever down. So I'm going to write this down for you. And then I would also recommend all of the cold remedies that I'm sure you already know. Drink some tea with honey, drink some chicken broth, take some cough drops, which I actually have some for you right here that I would like to give you, since we have so many of them in the office. But these are a good one that you can take. And these are honey lemon flavor. And I'm actually going to send a note to Lani, the receptionist you talked to. I would like to have her call in a prescription for you now for two things. The first thing is a throat spray. So this is not an over-the-counter throat spray. This is one that is from the pharmacist, and it will definitely help your throat and just get rid of that scratchy feeling you have. Okay? So I'll have her get you that. And then the other thing is a vitamin C pill. So whether you're taking multivitamins or not, it's always good to have a high dose of vitamin C when you're not feeling well. So you will just be taking those once a day for the next 7 days. Well, it was so nice meeting you this afternoon, and I'm sorry you're not feeling well, but I promise with some rest and relaxation, you will start to feel better soon, okay? So like I said, Lani will help you at the front desk, and if you need anything at all, make sure you contact us, okay? And make sure you call if your symptoms get any worse. Okay. Alright, well, take care, and I hope you feel better soon.
Hi. How was the exam? Very good. Yeah. Okay. Did the doctor, was she able to answer all the questions for you? Excellent. Yep. And so she checked out your throat and everything? Okay, perfect. Alright. And I see that she made some recommendations for you, right? For some medication? Mm-hmm. Okay, so I see here that she would like you to take vitamin C once a day for the next 7 days, okay? So I have a prescription here for you that you can pick that up, as well as a throat spray. Yep, and this throat spray is going to be a little bit different than the ones that you can just go and buy in the store without the prescription, okay? Alright, so make sure you get this one. Excellent. Okay. And so, what is the pharmacy that you would like the prescription to be sent to? Okay. And what is the address for that pharmacy? Okay, perfect. Alright, so the vitamin C is going to be once a day for 7 days. And then the throat spray, you can use it about 3 times a day. And then really probably about 7 days as well, or until your throat starts to feel better, okay? I suggest not taking it more than 2 weeks. Obviously, if your symptoms haven't gone away after, a week and a half to 2 weeks, then definitely give us a call so we can get you back in here, okay? Alright. Okay, and do you have any questions about your prescription or anything? Okay, and so typically we'll go ahead and send over your prescription information to the pharmacy so that they can get it filled as quickly as possible, okay? And so I recommend probably checking either this evening or tomorrow morning to see if your prescription is filled. Probably go this evening just in case it's ready so you can get started on the medication as soon as possible, okay? Alright. Yep. And if there's any issue, you can always give us a call, okay? And so, let's see. Besides the medication, please make sure you're getting rest and drinking a lot of liquid, okay? Yeah, so lots of water, staying hydrated. That's very important for your throat to heal, okay? Yeah. Yeah. Okay. Alright, so this is the paper with your prescription information on it, okay? So you can take that. And then we'll also send some more information to your email, okay? So, with your insurance, it looks like your medication should be free, which is great. And it looks like your copay is only going to be $1. So, do you want to use cash or credit card for that? Okay. Alright, yeah, you have really awesome insurance, so that's really nice. Okay. Alright, perfect. And so we don't really need to schedule a follow-up date or appointment since it's just a sore throat. Obviously, unless your symptoms continue, there's no reason to do that. So just make sure you're staying healthy and get better quickly, okay? Alright. Okay, well, I think that you are good to go. So, again, if you have any questions, feel free to call us, okay? Alright. Okay, well, I hope you feel better soon, okay?